Looks like we're ready to get started, so I'm going to stop screen share and kick it over to our speakers to begin.
Looks like we have everyone here, and so welcome to our session today. And just to make sure that we are all in the right place, this is a breakout session on good health and well-being, SDG 3, and we're going to be talking about global health systems, vulnerability, and resilience through the pandemic. So thank you all for being here. So to start off, my name is KJ Zuniga. I am a senior consultant at Linksbridge, a social purpose corporation based in Seattle that provides consulting and advisory services to not-for-profit organizations and multilateral organizations. And I'll be moderating today's discussion. And I am very fortunate to be joined by these three panelists who will be providing their unique perspective on the pandemic's impact on health systems across the globe. This pandemic has certainly highlighted both the vulnerability as well as the resilience of our health systems, and we're excited to dig into that today. First, I'd like to briefly introduce our panelists, starting with Simba Yaniwa, who is the Senior Manager for Supply Chains at Village Reach. And he leads their supply chain strategy for the COVID-19 response, providing supply chain technical leadership and support to country programs. Welcome, Simba. And next we have Lakshmi Sathraman, who's principal at Sattva Consulting. And as the lead of their health practice, she's an advisor across Sattva's key health projects and is focused on building knowledge and ecosystem level partnerships across core health areas. Thanks for being here. And then last but not least, we have Shivanshi Kapoor, who's a Senior Program Officer Strategy at PATH South Asia Hub. She's involved in the primary healthcare portfolio and the respiratory care portfolio, especially focusing on ensuring access to medical oxygen in India during the first and second waves of COVID. Thank you all for being here. Really excited for this. So to kick off our session today, I'd like to hear from each of you. So I'm hoping you could tell us how your organization has responded to the pandemic and what needs have you seen in your countries of operation, and how has your organization addressed them? And I'm going to start with Lakshmi. And so would love to hear from you first. Thanks.
Thanks, KJ, and thanks so much for having me here today. Sattva is a consulting organization that's focused exclusively on social impact, and we're based out of India but operate globally. Given where we are in terms of working at the nexus of various different stakeholders that are working for impact, we were uniquely positioned to respond to the crisis in a fairly collaborative fashion. So right from the first wave itself, our response was multidisciplinary, in the sense that one, we were part of a collaborative setup called ACT Grants, which really brought together the entire startup community in India, that in a non-profit kind of a manner, to really address the pandemic response. So bringing in private sector and public sector together, really looking at where the need is and responding accordingly. And we were a core partner, both in terms of designing really how the initiative would shape up, as well as supporting with the execution of the same. And beyond even just that, our focus was looking at some of the second order effects of COVID. So looking at education, the impact on livelihood. We had a crisis with a lot of the migrant population in India really sort of losing their livelihood overnight. So really looking at ways to address that. So there were several ways in which we looked at devising solutions, of course, in collaboration with a lot of our partners. I do want to talk a little bit about the second wave, though, and particularly how devastating that was for India in terms of just at its peak, we reached about 400,000 infections, new infections a day, and several thousand deaths as well. And at that point, I think the vaccination, hadn't really taken off. There was scarcity of vaccines. And at the same time, the health system was completely overwhelmed, right? So again, what we did in partnership with several stakeholders through the ACT Grants program was really look at one, of course, addressing the oxygen need, really responding immediately to, so looking at oxygen concentrators, both within India, looking at overseas support, really trying to get stuff where it was needed the most. But in addition to that, also just having a slightly long-term view as well. So we worked with about 100 hospitals to help them set up PSA plants within their facilities and premises themselves, just so it becomes a more sustainable way and they become less dependent on, let's say, sources outside of their own facility. In addition to that, our focus was heavily on really how we can vaccinate especially vulnerable folks as much as possible. And the focus was on low-income communities that were densely populated and which posed a high risk of being a super spreader community if they did catch the infection. So really trying to see how we could get that get vaccines to them in times of scarcity, as well as folks whose livelihood was again at a high risk of exposure. So garment factory workers, construction workers, people in the delivery business that would deliver food parcels and all of that stuff home, right? So just making sure that we get it to them as much as possible. And here is what we we tried to bring together several stakeholders, again, across sectors. So we had private sector actors, hospital chains that lent their human resources. We worked with supply chain folks who supported with cold storage, solutions. We worked with civil society that actually worked with these vulnerable communities to address hesitancy issues, and of course with the government, right? So really kind of trying to do this together and get vaccines to the communities, as opposed to really, having them come elsewhere. And we were able to, do this for about 500,000 people across different regions. And we were able to showcase that this is possible to do, going closer to a community and really taking a very localized approach, right? And hesitancy was actually something that we faced significantly across communities. And the reasons were very diverse. India is a very diverse place, and it was very localized, and you had to address hesitancy also in a very, very hyperlocal manner, right? So while we did look at vaccine hesitancy campaigns that were more overarching, that, like television campaigns using celebrities and things like that, we also ensured that the on-ground focus was very strong. So really looking at local influencers, engaging with them, also ensuring that the timeliness of them speaking with the community and engaging with the community coincides with when the vaccines are available. So just making sure that some of these things, fall into place to ensure maximum uptake was something that, we did and were able to do well. So yeah, so that's just a little bit about what we did, KJ, and happy to share more as we go along.
Yeah, thank you so much. And Shivanshi, you are also working in India and South Asia. So how has PATH responded to the pandemic?
Sure. Thanks, KJ, for that question, and also Lakshmi for already providing a great perspective on, how what the situation in India has been like. So as KJ mentioned, I belong to an organization called PATH. Some of you would know that it's an INGO that works to accelerate health equity and innovation across 5 themes, basically. That's vaccine, drugs, diagnosis, devices, and health system strengthening. And we've been around in the sector for over 40 years now, basically responding to diseases, healthcare, and strengthening the systems. Talking of the last 2 years, they have been extremely challenging. We have seen how COVID has literally upended our lives and ground the world to a halt, putting unbearable amount of pressures on the health systems. I recall that in early 2020s, when COVID had started spreading in India, we, like any other organization, were obviously not prepared to handle or respond to something like this. However, it was our resilience and ability to adapt to the changing health situation that we were kind of able to address the challenges that arose as a result of the pandemic. I mean, almost immediately, we kind of repurposed all our existing grants to support the nation, and the donors have been extremely supportive there. Talking about some of the gaps that we saw, and also, how we kind of responded to those. So firstly, I mean, as soon as the COVID had kind of started spreading, there was an increase in number of patients. There was this whole challenge around notification of the cases, and collecting, collating, and managing large data sets, which was obviously absolutely critical to both collect and also analyze, to allow the government to prepare themselves for what we were going to experience in the days and months to come. So I mean, that was a critical gap that we saw, and we at that point worked very, very closely with both the national and the state government through our existing program teams to set up systems to capture this data and also analyze this to ultimately prepare response plans and roadmaps for the future. So that's one. The second gap that we saw was in terms of the human resources, and that, as we know, is absolutely critical for a strong health system. And this was mainly for two reasons. I mean, the public health facilities in India are anyway understaffed. And secondly, obviously, because, I mean, this was a challenge that we were facing not only on the professional front, but also on the personal front. So anyway, there were human resource gaps. So we also supported the government in filling those gaps by deputing some of our staff in the interim, and then, and then counseling and training the staff to prevent, detect, and stop the disease outbreaks once there were additional people in place. Thereafter, another challenge with the surge in the number of cases was, the whole challenge around testing. That was in itself a challenge, because when the cases started increasing, there was a problem of wrong diagnosis, delayed testing, delayed reporting of cases, and obviously delayed isolation, which then again led to, the spread of the virus, the spread of the infection. So it became the whole chicken and egg situation. And I'll tell you the reason for that. It was primarily because, the majority of states under the guidance of the central government, our central government, was focusing on the implementation of the RT-PCR tests. That was like the unidimensional approach that we were following. But that, coupled with a sharp surge in numbers, had put immense pressure on the RT-PCR labs also. And then it obviously led to the delayed testing at these labs and delayed reporting of cases. So, I mean, at this point, what we did was that we were working very, very closely with the innovators and startups to demonstrate new cost-effective, sustainable, and scalable testing solution packages, that lead to faster turnaround time, reduce burden on the testing laboratories. So there were a few solutions that we identified, and we've also demonstrated that across various states. I'll just name a few. They are Now ID, SpectraLit, Lumify, CureAI. Some of you might have heard of. While SpectraLit is still under approval, but all the others we've actually kind of tried and tested and demonstrated those, and they give tests. The test results you can get in less than 5 minutes or so. So they're extremely effective. Thereafter, another challenge which Lakshmi touched upon was the whole behavior change of the larger community to prevent the spread of this disease. That was another challenge. We were struggling to get people to take the vaccine initially. owing to all the apprehensions around it. And as Lakshmi said, I mean, they were, for various reasons. I mean, there were people who felt that it would make them sick. There were people who felt it was expensive. There were people who felt, it was all a political this thing. So, I mean, there were all these apprehensions. So to fight those, and we at that point realized what role a targeted communication with the community plays, and especially in instances like this where the cure is yet to be developed, and all you can count on is the behavior change, or the way the community reacts to something like this. So in this case, I mean, PATH again came in and it assisted the governments across the country to deploy IC strategies, well-planned IC strategies to create necessary conditions. We conducted a behavior change study to identify what are the kind of key points, how should the messaging be directed to some of these people. So we did work in a few states around that, and it has, I mean, it seemed to be effective. Now, we continued to support the country along these lines until the devastating second wave swept through India. This was in May this year. Now, during that time, the oxygen needs kind of skyrocketed, but thanks to the influx of support from the individual corporates and foundation donors that we got, that we were kind of able to reach, we were able to accelerate our work and reach more people faster. We, I mean, overnight set up a PATH COVID-19 emergency oxygen response task force. We pulled people from various project teams, and this task force was established. And I take immense pride in saying that this task force has been working day and night since then to ensure that we provide support to the nation at this time when it needs it the most. I mean, we supported all the high burden states, 24 out of the 28 states in India, to procure PSA plants, increase their capacity to produce and supply oxygen in-house, and also supported the states to kind of strengthen the entire process, the oxygen delivery process. I mean, it's a process from like planning of oxygen to delivery, training the workforce, and developing tools that could actually forecast the potential demand for oxygen. So we've created a bunch of tools, and also directly kind of supporting the hospitals and the state governments resolve the issue of oxygen. I will try to wind this up now, since I think almost on time. I mean, just want to add that, COVID has demonstrated the speed at which our country has mobilized to fight this disease. And while we were certainly not prepared for tackling this pandemic, I mean, when we got into this, we are working rigorously. All the organizations here, I think, are working rigorously to ensure that we are we're kind of ready for anything that comes up, or any other pandemic, God forbid. I mean, not hoping for another one, but yeah, we're certainly better prepared now. So I'll pass it on to you, KJ.
Thank you so much. PATH has been very busy the past 2 years. So now I would love to move and get more of a perspective from Sub-Saharan Africa. And Simba, can you tell us a bit about Village Reach and their response to the pandemic?
Thank you, KJ. You shall forgive me. I have some bit of a croak on my throat, so my voice is not really clear. But I think, as some of you might know, Village Reach is an NGO that has been operating in Africa for some time. We focus on transforming healthcare to make sure that healthcare reaches everyone who needs access to health, including to the hardest to reach areas and the last mile. We are actually celebrating 20 years of existence, have been operational in Sub-Saharan Africa. We started off in Mozambique and have been growing into Malawi and DRC now, which form the three sort of core countries in which we have fully fledged teams and country directors that work there. We also have a couple of what we call partner countries in which we are operational. An example being in Cote d'Ivoire, in Tanzania and in Liberia, where we have our staff based there working to support the governments to ensure that people have access to healthcare. So during this COVID pandemic, I think Village Reach, we were quick to come to the fore after a thorough realization of the unique role that is played by community health workers in delivery of health services, especially during a pandemic, and particularly in countries like the ones where we work in, we generally have less resilient health systems. We know that community health workers are usually relied upon when pandemics of this nature come to go into their communities to bring services closer to the people. But we also understand that in many countries they are not really recognized health workers, and as such they are in most cases the last ones to receive health commodities, health products, including personal protective equipment like the PPEs. And this leaves them vulnerable to contracting disease. And it also means they won't be able to discharge the very important service that they need to serve their communities. So what we did as Village Reach is that when COVID began to spread across the world, we partnered with other 5 organizations, the Community Health Impact Coalition, Directly RIF, the Community Health Acceleration Partnership, Pandemic Action Network, as well as the Community Health Acceleration Partnership and Village Reach. So we partnered these and came together to form what is known as the COVID-19 Action Fund for Africa, which is shortened as CAF Africa, to help raise funding and supply community health workers with PPEs, the most important PPEs that they wanted to get in the field. And I'm glad to say that to date, through the CAF Africa initiative, we have been able to distribute over 80 million pieces of PPE across over 900,000 community health workers in Africa, across 24 African countries. And this has been a huge lift to the community health workers in the field, and that has led to them being able to get the protection they need as they deliver the services that they need to deliver. Apart from that, we are also actively supporting the governments in Mozambique, in Cote d'Ivoire, in the Democratic Republic of Congo, to make sure that they are able, their systems are ready to be able to ensure access, equitable access, and this is important, equitable access to COVID-19 vaccines across the different geographies. In Mozambique, we were quick to realize that as more and more vaccines began to come into the country, mostly in an ad hoc manner, it became very challenging for the government of Mozambique to be able to move those commodities right down to the last mile. And as such, it was very important that we were able to quickly come up with a distribution mechanism that relied largely on adapting our existing partnerships in the country. We, together with the government of Mozambique, had been working together with private sector distributors through the USAID funding for our last mile supply chain program. We were able to quickly integrate COVID vaccines into a routine distribution mechanism that is provided through the LMSC project. And this was very important because of the nature in which the vaccines were coming into the country. And we did not only manage to do that in Mozambique, in Malawi, in the DRC, we were able to quickly work with the governments there with Swoop Aero to be able to identify alternatives of delivering vaccines utilizing the drone system, which is what we were able to quickly turn on to. One of the things also, I think that became very clear at the beginning was that as the pandemic was spreading, so was the infodemic. I think we realized that it was very, very important to make sure that information is made available across different countries, across our communities. People get the right information on this new pandemic disease. So in Malawi, we supported the government to quickly adapt one of our existing solutions in Malawi, which is called Health Center by Phone. I think some of you have heard about Chipatala Jabafoni, CCPF. So we were able to quickly utilize that system, adapt it to be able to start, sending out, COVID disease messaging to the communities. We're able also to use that system to be able to make sure that the right information is sent out to the communities. we basically went to the government and made sure that the government just utilized the same hotline operators that they had in the country, trained them on this new COVID-19 disease, and then they're able to spread the message across the country. So those were some of the things that we were quickly able to do across different countries. And I'm glad that we are still working very closely across all our countries with our government partners to make sure that we develop, health systems, supply chain systems that are agile, supply chain systems that are resilient, are able to quickly, respond to a pandemic of this nature going forward. I will stop here and allow others to come in as we go, and I will share more as this discussion progresses.
Thank you so much. Very, very interesting. I heard some similar themes, but also some unique challenges that your organization has faced. So I'm actually going to go back to Shivanshi, and you had touched briefly on medical oxygen needs during the second wave. And so I'm wondering if you could speak a little bit more about what PATH is doing to promote sustainability in the medical oxygen system in India.
Sure, KJ. So, for us at PATH, long-term vision is critical. It's not just for medical oxygen or the respiratory care program, but across all our programs, our focus always is to ensure that any program that we implement is both scalable and sustainable. So we work very, very closely with the state government or the national government to kind of get their buy-in and align on expectations. But particularly in case of medical oxygen, we all know that it's very, very difficult to scale up something like medical oxygen overnight. So, when a crisis strikes, we must already have the systems and infrastructure already in place. From supply chains and production capacity to storage and transport, we should have everything on point. Unfortunately, that was not the case, obviously, during the second wave or even the first wave. When the pandemic hit us, we were obviously not as prepared, and this is really because this kind of forward planning often falls down the list of public health priorities during normal times, but we've seen what it means when the demand spikes. In India, we've literally seen it to be nightmarish. It was a difference between life and death for a few people. So, we are particularly careful on all the respiratory care work that we are doing. We are conducting everything with long-term sustainability in mind. So, while we are addressing the short-term urgent needs of the states, of the facilities, we have the long-term sustainability as the goal. And the critical areas that we are touching upon are really the gaps that we've seen over the longer run. So, obviously, to start with, there were no PSA plants really in most of the even tertiary care hospitals, even the medical colleges here. There weren't PSA plants in a lot of such facilities. But then it was mandated by the government also to have a PSA plant in every hospital that's over 100 bedded, that has over 100 beds. So we as I said, we have worked to set up close to 1,200 PSA plants in 24 out of the 28 states that we have. So that challenge is kind of sorted because we have established a long-term, a PSA plan that is there to stay. Now, the next challenge that we saw in places where there was already a PSA plant was the challenge of maintenance and operation of those equipments, which was not being carried out. They were obsolete, etc. So we've now made it a point that we put a plan in place to support the maintenance and operation of equipments that we are putting in place. We are advocating with the government to ensure that there are budget lines for these things. Because, while we have a contract for say 5 years with our implementing partner, with our agency that we've got the PSA plants from, but then what happens after 5 years? So we are, it's very, very critical to ensure that the government, there is government buy-in, and there are budget lines, and the government sets aside budget for maintenance and operation of these equipments. And we are also simultaneously working with other local implementing organizations to enhance capacity for maintenance. So that's what we are doing on the maintenance and operation side, which we have seen to be a critical problem in the past. The next problem that we saw, to our surprise, was the training of healthcare workers. While even in the facilities where there was medical oxygen, there were patients, who were not given the right. So there is how much oxygen is to be given to a particular patient. So there is a proper training to do that. There's a proper training to kind of handle the respiratory care devices. What should be the flow when you're providing oxygen to a patient? So we've kind of seen that the healthcare workers were not trained in providing respiratory care and in the use and delivery of medical oxygen. So in order to address that, again, that's a long-term problem, although obviously these healthcare providers or healthcare workers will move on, but we are trying to, while we've built the capacity of all the healthcare workers that are present in the facilities where we've installed these PSA plants, we are also making it a point to prepare, guidelines, guidance documents, the training material, and we're sharing that with the facility to kind of train the next set of healthcare providers, so that we must have healthcare workers who are trained in medical oxygen delivery and trained technicians who know how to maintain and repair the equipment. So training and capacity building is another very, very important component which we are focusing on, because these are the people who kind of provide us the medical oxygen. Even if we have the devices in place and we don't really know how to use them, there isn't much point. So ensuring that we have trained health workforce at all times was extremely critical. The third challenge that we saw, and this was really when we were carrying out facility assessments to install these PSA plants. So the process really is that, you carry out the need assessment, you work closely with the government to identify what are the facilities where you will be installing the PSA plants. And then you carry out a facility assessment to see, if there is there's a certain infrastructure that's needed to set up a PSA plant. You do a facility assessment then to see if there is adequate infrastructure. And again, that was another problem that we felt, because a lot of facilities where we did the assessment and we saw that there, even the basics like the electricity, were not in place. There wasn't power. There was no power supply, which, and that continues to be a problem in the interior parts of India. So, that's very common here. So now we are exploring the use of solar energy, solar power to run these PSA plants, which is a great solution for on-site oxygen production. But it obviously requires reliable energy to run well. So, so we're exploring that as well with some of our partners who work in the solar energy. We're talking to Selco and others to kind of set this up, demonstrate this, and then this can be scaled up by the government in all the other facilities where we've installed PSA plants. So, ensuring that at least electricity or power is in place, that's another thing that we are kind of working on. In addition to that, we are looking at developing new oxygen production and supply models, because that's another challenge that we've seen. That there is, during the time of crisis, there was, say, medical oxygen, or there was oxygen in one facility, but then there were people in the other facilities. There was excess patient load in the other facility, and they couldn't access oxygen, while this hospital, which had oxygen, was like just a few kilometers away maybe. So what we are trying to do is, trying to have a hub and spoke model sort of a thing, so that, I mean, that will enable one facility's PSA plant to refill cylinders or cylinders with excess supply that can then be shared with the nearby facilities. So, I mean, that's again, I mean, the hub and spoke model that Path has been working on. We're trying to kind of replicate that here in the respiratory care field also, to ensure that, you know, even if a facility falls short of oxygen, they can get it from a nearby facility. So a hub and trying to create a hub and spoke model sort of a thing there. So yeah, that's just some of the ways in which we're trying to ensure the sustainability.
Wow, thank you. That's again a lot of work, and it's interesting to hear both the capacity building for the short term as well as the long term in terms of physical infrastructure as well as the human resources and training there. And I imagine, especially with respiratory care, that might have previously been more of a niche or specialized area of healthcare, and now it's becoming, you know, necessary across the board, unfortunately, due to the pandemic. So yeah, thank you for sharing that. I'm gonna go back over to Simba and ask you, how is Village Reach pushing for vaccine equity in sub-Saharan Africa? Oh, you're on mute.
Yes, thanks for that. Thanks, KJ. So one thing that we understand is that, you know, considering equity in supply chains is particularly very important for areas with very low coverage rates. That can be in very, you know, remote rural areas, but it can also be in some inaccessible urban centers or urban areas. And there is also this very huge disparity between, you know, the normal urban centers and the rural areas in terms of access to COVID-19 vaccines, which also reflects on general medicines distributions and service delivery. So what we have done at Village Reach is that we have designed, we developed a 4-step guidance that governments, implementing partners can use to purposefully consider, you know, equity in supply chain design. In this guidance, basically, we assess health product supply chains from a holistic point of view. So that would include the public sector, that would include the private sector delivery. And we look at how supply chain factors generally impact equity in immunization. This 4-step guidance is actually meant to ensure that we provide guidance to decision makers as they make decisions about their supply chains. In terms of just breaking it down a little bit, one of the key steps that is in this 4-part guidance is that, you know, you need to be able to identify the kind of population that you need to reach with, you know, medicines and services. What are your country's underserved populations and what are their characteristics? So these populations can be, like I mentioned, urban poor population that often accesses medicines from, you know, private sector, because private sector services are easy to get, and you know, it's easier for one to get to a private sector private sector facility than to go to a public sector facility. This can be a remote rural population, maybe that often has to travel very long distances for them to be able to access care. The second guidance we give is, you know, countries need to consider supply chain related challenges. What are these specific challenges that might result in, you know, low coverage amongst this population? These may range from, you know, supplies being unavailable, you know, broken down, you know, distribution mechanisms, non-functional distribution mechanisms, a whole range of supply chain considerations that need to be understood at this stage. And then thirdly, you then need to have some mitigation strategies. What are the appropriate strategies that you need to take in order to address this challenge? So these are some of the key steps that you take. And then lastly, of course, you need to make sure that you then are able to measure the progress towards ensuring that vaccines are available across the different geographies. we have developed this guidance, and we are working on a project that will look at, rolling out this guidance across a number of countries, get countries to use this guidance and help them, use that to help them inform the decisions that they make. We have also been involved in a number of, initiatives just to make sure that, vaccines are able to reach to the last mile. In Mozambique, we are working together with the government of Mozambique, conducting vaccination campaigns within Maputo and other urban areas. These are targeting mainly the high volume sites. In DRC recently, we established a high volume site that is going to be focused on ensuring that we are able to reach as many people as possible through this high volume site. We will make sure that all the system, we will make sure that all the requirements of the system are met at this site so that they are able to vaccinate as many people as possible within the space of time that we have set aside. So these are some of the initiatives we're actually looking into getting into Cote d'Ivoire in the next couple of weeks. To also set up a similar high volume site that will be, targeting those highest populations within, concentrated populations within city centers to ensure that we are able to reach as many people as possible. But we should also not forget that while we're doing this targeting at these very high volume sites, we are also working in the background to make sure that, people across the different geographies within the countries we work are able to equitably access the vaccines. This is the work that most of our last mile approach is focusing on. Like I mentioned earlier on in Mozambique, we are working through our LMSC program project that is funded by the USAID to make sure that we integrate vaccines into routine, commodity distribution systems. This is the work that we have also been doing across the different countries we're working in Malawi, example also. We are supporting the ministry to make sure that vaccines are distributed to the last mile. Because what we have seen from the initial phase of rollout of vaccines, what we noticed was that most countries adopted an approach where they would get the vaccines into the country, distribute the vaccines to the provincial level. In some countries like Malawi, they ended up at the district level, but there was no system that would then take those vaccines from that level to the very, very last primary health center and beyond the primary health center to make sure that the health center personnel are able to provide the vaccines to the communities. So these are some of the activities and approaches and innovations we've taken up to make sure that we improve vaccine equity within sub-Saharan Africa.
Thank you. Yeah, it's good to hear this holistic approach to the supply chain. I think we often hear about getting vaccines into a country, but then once that happens at the central level, how do we ensure that there's equitable distribution across the country? So thank you for digging into that a little more. And so I'm going to now go back to Lakshmi and maybe taking a step back a bit and just looking at overall health infrastructure. What does SATVA see to be the biggest opportunities for health infrastructure in India?
Thanks, KJ. No, I think that's a great question. And I think, honestly, COVID has sort of given us an opportunity to just rethink the whole system strengthening part of health, right? And I think while we've been talking about it for a long time, the focus on system strengthening has really, the talk has moved a little bit into action, I would say, post-COVID, right? Whether it's the government, whether it's the donor community, and even implementing organizations, I think the system strengthening is something that's become almost a sort of a buzzword now, I would say, within the ecosystem. So I think there are a couple of areas, that I think will be are important opportunities for us to leverage at the moment. One, I think, is the importance that has started to come towards primary healthcare, right? And I think, again, just from what we've seen through COVID and just the overburdening of all of our tertiary facilities, right? The fact that we did not have an effective primary healthcare system to just sort of reduce that load and make sure that efficient referrals were happening, I think really came to light. So, even in fact, during the pandemic, it was almost like we set up a lot of these smaller triaging centers. So it was almost a system that was set up over a few weeks to kind of address COVID related triaging, which could have been done effectively if we had a stronger network of primary healthcare players, right? So I think the importance of that has come to light, and the government has also, doubled down on its focus on strengthening primary healthcare across multiple areas, right? So one of the other things that COVID also taught us is that not really looking at disease verticals in silo, but really looking at a multi-disease kind of an approach. We realized how we could repurpose, let's say, testing capabilities for one disease to another. So that sort of innovation has also, I think, made us more confident to look at it more broadly and look at use cases that can solve for that rather than looking at it in silos. So I think just integration across all of the programs, even within healthcare itself, and looking at a better primary healthcare system is something that I think we should leverage. And again, not just with the government, but even with the private sector. So in India, there is a very, very strong, private sector health providers themselves that are, particularly in terms of outpatient care and primary healthcare, play a huge role in the delivery of care, right? So there's also an opportunity to strengthen that entire ecosystem today as well. And, right from bringing in standardization from a quality standpoint, improving capacities overall, right? So that's, I think, one strong area of opportunity, just keeping in mind the environment, I think the ecosystem can act on. The second is really technology, right? I think what we again saw through COVID is almost a forced adoption of technology overnight for multiple things, right? So right from, let's say, access to doctors through telemedicine, or even capacity building of, health professionals using tech as a medium. And I think what, again, while technology has so much potential, just in terms of reducing the gap to access, ensuring, standardization in terms of quality, bringing in more efficiencies in the system, it's also critical that, we take people along, right? So what we also realized is that you can't do technology in isolation. You have to have buy-in from the citizen in terms of, the folks that are accessing the care, to even actors within the system. So if you're looking at a frontline worker and having them, let's say, being more empowered in terms of doing more than what they were already doing and enabling task shifting and things like that, you need to make sure that you're addressing their pain points. You're addressing, you're building their capabilities so they don't see technology really as a burden and, something additional that they have to do, but really look at it as a tool that can ease their workload. So I think technology is a second really big opportunity, and it's critical for us to make sure that we deliver it well. And here again, given just the sort of leapfrogging in terms of the adoption of tech overall and across the system, I think it's important to sustain that, and therefore focusing on the people aspect as well to make sure that happens, I think, is the second piece. And the third is really data and governance, right, which sort of go hand in hand, which is again something that tech can support with, but overall having a repository of, where you can look at data in a transparent way and across the chain, right? So even if I'm a frontline worker, I have the ability to really see the impact of my work in real time. That data empowers me better, right? Not just someone who's at the administrative level and making high-level decisions. So really having, data and governance mechanisms as well, that we can strengthen through data is where I think is the third opportunity that I would say we should leverage at the moment. Yeah, and just from a tech standpoint as well, KJ, India right now has a fairly robust, enabling environment there as well. So we have, the digital mission, the Ayushman Bharat digital mission that the government has, also set up really with the focus on democratizing care, right? Healthcare through technology. So I think, again, opportunity wise and environment wise, we're at the right time. We just need to make sure that we leverage the opportunity appropriately. Yeah.
Great, thank you. Yeah, I think your point about, looking to building up the primary healthcare system and moving away from silos is important. And then also, of course, the technology, data, and governance, that's going to be very critical for all of that as well. So thank you for sharing your thoughts on that. So before I move to the last question for each of the panelists, I do want to remind our audience here to please put any questions you have into the Q&A section in Whova. We're excited to hear what you'd like to learn about. So please do that. And so, for this last question to our panelists, I want to take a step back a bit and have you all reflect a bit on the future. And so as we are hopefully shifting away from more of a global health emergency to a long-term approach to an endemic virus, what changes or approaches should we make permanent as a health community? What changes that we've seen in the past couple of years should we be making permanent? And I'm going to start with you, Simba. I'd love to hear your thoughts on this.
Thank you, KJ. I think, as I mentioned earlier on, we at Village Reach do realize the very important role that our community health workers play in delivering health services in the community. So I think one quick thing that I would like to share is that I think it is important that community health workers are well equipped as an integral component of the health service delivery system. They do enhance the capacity of the health system to be able to reach the underserved, underreached populations, and equipping them with the right tools then contributes to optimizing their ability and the quality of service that they provide. So I think generally governments across the sub-Saharan continent should, be able to establish the community health workers as an integral part of their health workforce. That way, I think would ensure that every donor, every implementing partner is well aware of the very unique, position that the community health workers are and their abilities in delivering healthcare. And then they'll be able to also support them with all the tools of the trade that they need to get. I think one of the things that we have been talking about, if you saw one of the papers we recently published, we were also focusing on making sure that governments should prioritize community health workers for vaccinations. So I think from our point of view, I think we would want to see the same support that, as I mentioned, that has been provided to community health workers through the CAF Africa initiative, should go beyond the pandemic. And I think establishing, different lines of support for community health workers through the donor systems, through our governments in a more sustainable way, would go a long way in ensuring that we are able to deliver healthcare services to the people in the communities and to everybody who needs it. Thank you.
Thank you, Simba. Yes, community healthcare workers are the front line and are going to be really important, continue to be important moving forward. Lakshmi, so you had touched a little bit on this in your last response, but would love to hear some more from you on what should we make permanent?
Yeah, that's an interesting question, KJ. So I think one, just wanted to underscore the point that Simba made, right? I think, just the community health worker, the component, I mean, we really kind of realized how critical they are. And we'll maybe extend that to say in India, for example, they're, considered a volunteer workforce that's paid more a stipend as opposed to, let's say, an organized as employees of the health system, right? So just making sure that we are able to go that extra mile to be able to recognize them and even give them the dignity that this requires, and the recognition that this work requires, through this sort of formalization, I think is very critical. So I think, just kind of talking about what perhaps we saw through COVID, which for me really kind of hit home, right, is just so two things actually, which I think we can strengthen as well. One, just the agility and the speed and with which our governments responded, right? I think even Shivanshi spoke about this before in terms of how we were able to respond so quickly. And it just almost felt like you were working in this really high energy startup kind of an environment where you were failing fast, learning fast, applying those learnings so quickly, being able to pilot solutions, innovations, and being able to scale them so quickly as well, right? So I think if there is a way for us to institutionalize that in some form through a playbook or a mechanism to just fast track some of those, that way of working, I think that will kind of take us a long way, if there's a way for us to strengthen that. The second thing is, I think just underscoring the aspect around collaboration and the intersectoral collaboration that we saw that was working, right? We always do see that collaboration takes time. It takes, a lot of energy to align common interests, come together towards something specific. But again, if we can create more proactively structured channels for these collaborations. So for example, the private sector collaborating with government, figuring out areas of support, really implementing innovations in a structured way within the government system. So I think if we can actually create formal channels for those to happen on a consistent and sustainable basis, that again is something that, I feel is something that we have to think about. And thirdly, just want to touch upon very briefly about the whole idea of One Health, right? And I think again, COVID has just again underscored that significantly. So how do we look at it? I mean, so it's not intersectoral, just let's say within the healthcare actors or public or private sectors, but really, looking at climate, looking at animal health, human health. So the whole, I think, One Health piece is also something that that has gained prominence and is something that we should look at as well going forward. Yeah.
Thank you so much. Shivanshi, what would you like to see made permanent as a health community?
Thanks, KJ. I think between Lakshmi and Simba, most of my points are taken, and I was just ticking off, all right. So one less thing to talk about. But yeah, I mean, COVID has really forced us to think creatively about how healthcare can be delivered. And if we take these learnings forward, we certainly will be able to make up for the pandemic's setback. I mean, within last year, there have been number of notable approaches, that need to kind of stay with us. And some of the things that I would really want to see, continue would be, so at the policy level, I think the whole decentralization of healthcare. I mean, otherwise what happens in India really is that the decision making lies with the central government. But in COVID, we see how the entire thing got decentralized, and the decisions were made closer to the community. I mean, the state governments know what the needs of their particular states are, and the center was kind of quick to address the needs of the states. We saw that in the time of the respiratory care needs also, there was a quota that was assigned to all these state governments based on the need, etc. So, I mean, it was very, very interesting. So more power, I mean, more power to the states to kind of respond to the needs of their own state. I think that was interesting and should continue. The whole point, I mean, about the primary healthcare that Lakshmi brought up, and the integrated care and the one that's closer to the community, that is absolutely critical. I mean, strengthening our primary healthcare to sort of reduce pressure on the secondary and tertiary facilities. That's very, very important. And I'm hopeful that that will continue because of the increasing commitment of our leadership to the whole Ayushman Bharat program that of setting up 150,000 health and wellness centers by 22. So I'm hopeful that this should continue. Then there is, I mean, again, at the policy level, the whole digitization of healthcare, that once again, Lakshmi touched upon. I mean, it was forced though, but it has been a boon for India, particularly during these times. I mean, from efficiently capturing data and maintaining records to, remote monitoring a person's health condition, and also providing treatment through teleconsultation, telemedicine. I mean, from using AI and ML to kind of build the capacity of healthcare providers and assisting diagnosis of health conditions, to rolling out a successful vaccination program through an online portal called COVID. I mean, I think the whole digitization is here to stay and will eventually lead to integrated care that we were talking about. Then again, a robust disease surveillance system that has become critical with the emergence of COVID. And I think it will enable not only in monitoring the evolution of COVID and, and identifying emerging mutations, but also any future pandemic. So, I mean, this should be integrated in our national disease surveillance program, and there should be continued surveillance and a robust disease surveillance system in place. Then coming to a step, I mean, taking a step down at the program level, then technology and innovations that that Lakshmi touched upon. I mean, India has certainly shown immense potential to, kind of quickly adopt and deploy products and process innovations to make the health system more efficient. So I think increasing adoption of technology and innovations and deploying and testing these in healthcare settings, primary healthcare facilities, for example, I mean, that has immense potential to shape the healthcare system, and this should definitely continue. I mean, it could reduce time, make the systems more efficient, more cost effective. So yeah, I mean, reliance on innovations and technology should continue and in fact increase if possible. Then the whole private sector piece, I mean, COVID has unfolded, the critical role that private sector plays in helping the health system and communities build and sustain resilience, whether it be before, during, or after an event such as the first and second wave of COVID. But I mean, it's a fact, and we've kind of said that time and again, that it remains largely untapped, or it's engaged far too late in the process. But private sector engagement is critical, and should definitely continue. Then again, coming a step down and more at the practice level, for example, I mean, at the community level, really. So the disease, I mean, we all know and we all accept that it's expected to live with us for a while now. So, until then, we need to kind of continue to strongly encourage our colleagues at the workplaces, at home, to adopt all the necessary hygiene and precautions that we've been doing. I mean, that's ignored very often, but I mean, COVID has actually instilled really good practices of hygiene amongst all of us, so that hand washing regularly, good hygiene habits, etc. They are a natural substitute for any medicine or any vaccine. So I think that should certainly continue. And then just one last point, which kind of suddenly popped up, was the whole focus on mental health. I mean, suddenly during COVID, people have started talking about mental health more than ever. So, I mean, that again should continue. A number of NGOs, organizations that I had never heard of that were working, on mental health have suddenly popped up. And I mean, there are discussions about mental health of, of healthcare workers, of people like you and me. I mean, working, and of the general community. So I think, I mean, we should talk more about mental health as we go along, because at least here in India, there's still a lot of stigma around that. So but we should kind of step up and talk about that. So yeah, I mean, those will be just a few points that I would add in addition to what Lakshmi and Simba have already said. Yeah.
Great, thank you so much. So it looks like there aren't any questions in the Q&A, but I certainly have plenty of questions that I'm happy to pull up. And oh, it looks like we just got one in, so I'll read this in real time. So wondering if you could share with the global health community about what you have learned with the pandemic. And so I think maybe that's, is there something surprising that any of you have learned coming out of this pandemic? And if I'm happy to call on somebody, or let me know if anyone has anything. Simba?
Yes, thanks, KJ. I think we have learned a couple of lessons as a result of this pandemic. I think as the COVID pandemic started to spread across Africa, as vaccines became available, I think one of the things that happened from that point was that there was a very huge increase in COVID vaccines demand. A lot of countries were working with a very limited supply of COVID vaccines, and this really slowed vaccination efforts in a lot of countries. I know in Malawi, at the start of the vaccination campaigns and programs, a lot of people were queuing at health facilities, waiting to get vaccinated, but they could not get the vaccines because countries had no access to vaccines. I think countries started to receive, vaccine supplies through the COVAX facility, which was basically aimed at accelerating the development and production of vaccines, but was also constrained by a number of capacity issues with existing suppliers who had been, who were supposed to be providing the vaccines. But I think one thing that we quickly learned was the importance of, creating innovative partnerships between vaccine manufacturers and other, stakeholders within the vaccine manufacturing space to be able to meet the global needs for COVID vaccines. I think one success story that we all know about is the Pfizer-BioNTech, collaboration, in which Pfizer with their innovative mRNA technology, and BioNTech and Pfizer with their ability to be able to mobilize max production capacity, etc. So this kind of partnership, if we could have a lot more of these partnerships, not only within the developed world, but also spread across different geographies with, for example, manufacturers that are based in Africa, manufacturers that are based in other parts of the world, and creating these innovative partnerships and being able to ramp up production capacity for COVID-19 vaccines and then being able to meet the country's demand. So I think this is one big lesson that we learned, especially after the huge wave that happened in India, and the Serum Institute could no longer be able to meet the capacity and the demand that was coming from COVAX. A lot of people disappeared from the lines and the queues that they were making at the health facilities, waiting for vaccines because there were no vaccines. Now, in the middle of that, we all know what happened with the issues of AstraZeneca and all those other, negative stories that were coming out of the media. Now, the ability to bring back those same people became a daunting task. because now there's a lot of myth, there's a lot of negative stories that happened during that period. So quick lesson, I think it is very important that some of these innovative partnerships that have happened before, that have been proven to be a success, if they could be scaled, across different continents. For example, in Africa, I think if we count today, I don't think we have more than 5 local manufacturers that can, produce vaccines on the continent. So these are some of the things that I think we have learned from this pandemic, and that these are things that we should take going forward. Another thing also, I think we also saw how important it is to create, robust coordination mechanisms, be it at a global level, be it at a regional level, at a national level, or even at a local level within countries. I think coordination also proved to be a very, very important thing for everyone to be aligned and to be able to, harness all our efforts and all our energies towards, making sure that people had access to vaccines and people are vaccinated, getting the shots in the arms, as we say. So those were some of the things that we have learned throughout this period. And I think these are key things that we need to take going forward. The issue of funding also is a very important issue. I think we've seen countries not being able to deliver vaccines because their supply chains are broken and there's not enough funding for them to be able to create, resilient and agile supply chains that are able to respond at a critical point in time like the one that we are in now with the pandemic. So funding issue, governments should make alternative sources of funding available to their national programs, for the EPI programs, but also, the broader global community can also be able to put together funds that can help assist countries during times of crisis like the one that we've just come out of. Those are some of the quick learnings that I can share at this point in time. Thank you.
Thank you, Simba. I don't know if either of you have a 1 minute, Lakshmi or Shivanshi, 1 minute response. Oh yeah, Shivanshi.
Sure, KJ. So yeah, a lot of what Simba said also applies to the whole respiratory care thing. So, collaboration and coordination with partners, certainly true. Health is not an area where, you can work in your own silos. It ultimately, what's important is to work in coordination with the other partners. You're good at something, someone else might be good at something else. So if we all come together, which we did during the times of COVID, and we've seen the results. So I think that's extremely helpful, because that helped us during the whole respiratory care, because we were, over a phone call, we were kind of able to arrange, concentrators and PSA plants when we needed to. And the second thing, the second very important thing, that while everything else can be developed, the basic healthcare infrastructure should be in place, because again, during the respiratory care, when we were trying to supply oxygen to some of these facilities, we saw that even though, the central government was supplying oxygen, and even when the oxygen was supported, there wasn't the basic infrastructure in place to store oxygen. So, there wasn't really much point in even kind of transporting oxygen to those facilities. So, because then you feel helpless, so having basic health infrastructure in place, and these are things that the government should think upon when we are not in the middle of a pandemic, and apparently during normal times, that we should focus on things like these. Yeah.
Yeah. Well, thank you. It looks like we're at time, so I just wanted to thank you so much, our 3 panelists, for being here. It's after 11 o'clock for our panelists in India, so thank you, and Simba, certainly after the end of your workday. One of my key takeaways, I have notes scribbled everywhere, is just really, I like this idea of, this focusing on the community healthcare workers and valuing what they can do, both in terms of their work with the community and delivering health products and services, but also combating vaccine hesitancy. They're kind of the face. So that was one of my key takeaways. I would encourage people to continue putting questions in the Q&A, because we'll have access to this, and our panelists can continue answering any questions you might have. So thank you so much for being here.